New York's first Ebola case is a 33-year-old doctor who was brought into isolation early Thursday afternoon. The procession taking Dr. Craig Spencer to Bellevue included 2 city ambulances and a police escort.
The EMS system brought him in with the proper protective gear. He was immediately brought to the isolation area that Bellevue Hospital has established for patients who could have Ebola. He has been taken care of by an excellent team.
An ER doctor comes home from an Ebola-infected region and turns up infected after days of waiting. Let us now dig into the medical side of this virus, now being discovered in New York City. Let's welcome to MidPoint, founder and host of The Doctor Weighs In, board-certified internist and emergency physician, Dr. Patricia Salber joins us. Dr. Salber, thanks so much for being here today.
Glad to be here.
How alarming is it to you, and upsetting perhaps as a medical professional, that here we have a fellow medical professional with Doctors Without Borders who is in an area that is infected by Ebola, comes home, of course does not show symptoms right away, but doesn't take even more steps to make sure, real cautionary steps, knowing what's happened here in America, to make sure that he was not infected and to make certain that this could not spread?
Well, first of all, I really want to say that this doctor and all of the healthcare providers who've worked with Doctors Without Borders are real heroes. They are doing work that most of us either can't or don't want to do. And so, that's the first thing that I want to say. And then in terms of how he handled his return to the United States, it's my understanding that he did not have a fever either before he left the country or after he got back. And when you don't have a fever or symptoms, you are not infectious. So somebody is not going to get it from you. Anybody who was on the plane with them has not been exposed. So I do want people to understand that. And then he actually was following the protocols that have been set up by Doctors Without Borders in cooperation with the CDC. So he was taking his temperature twice a day and monitoring himself for symptoms. And the minute that he got symptoms, he called the appropriate authorities. And as you had on earlier in your segment, he was transported to Bellevue, where he's now in quarantine, and his fiance and I believe one other person is also in quarantine.
Well,
so
let me ask you this, if I might, because we only have a short couple of minutes here. Are the protocols then enough when we take into account that he had to wait until he actually showed some symptoms? Is it enough, and is it preventative enough to make sure that this doesn't become a nightmare?
I actually think that this was handled very well. Unfortunately, we had to learn from what happened in Texas, where there were some missteps. But I think this is a reasonable protocol. You could say perhaps we should go one step further and put everybody who comes back into the country in quarantine for the entire 21 days. But there are 100 people a day coming back from that area. And that would rapidly build up to a fairly large amount of people who are in quarantine, most of whom, at least during the period of time where they're not symptomatic, don't actually need to be in quarantine.
Do you perhaps, though, shake your head just a little bit when you think of New York City, 8 million people, and even one case of Ebola? Again, we don't deal in panic here, but we certainly know how quickly this virus can spread.
Yeah, I mean, I think the panic actually spreads faster than the disease. There's been a lot of Ebola hysteria, not minimizing that the city needs to be prepared and that this is a scary disease. But I think that they've put appropriate precautions in place, and it's my understanding that Bellevue has, in particular, been prepared to handle taking care of cases of Ebola.
Is it fair to say that if you're going to have somebody who's showing signs of Ebola, that maybe New York City is one of the 2 or 3 places in the world where you want it to happen simply because of how they operate and that they are prepared?
Well, yes, I do think that our hats can go off to New York City for the preparation that they've done. But I think we're starting to see hospitals across the country prepare. This morning, I got an email from my hospital system telling me, and all the members of the hospital system that I belong to, about the work that they had done, including hands-on practice for how to take on and off the protective gear, which is a period of time that we know that puts the healthcare workers at risk.
All right, we're hopefully going to check with you again very soon, and hopefully we'll have better news to talk about that time as well, and good news about what's happening in New York. Dr. Patricia Salber, thank you so much for joining us.
Thank you.
Next on MidPoint, the government's response from the state and local level with regard to Ebola in New York City. And later at the 34-minute mark of this hour, terrorism panic anew thanks to a guy wielding a hatchet and people trying to decide if indeed this is connected to some form of Islamic terrorism. Again, we'll drop the panic, deal in the facts when MidPoint continues.